All right, so we're going to talk about all the positions that the coccyx could be fixated into, which then can create a hard infill that we want to mobilize to then recheck if what we did was helpful from all the different considerations that we talked about in a previous video. Okay, so with this, the options that we have, all right, there's kind of two different classifications. We want to look at what's happening at the joint, right? So the sacrococcygeal joint is this joint here. And then we want to look at larger picture what's happening throughout the whole body, okay? So if we're talking about just the joint, think motions that we could get, and I'm going to act like I have the coccyx in my hand here. Motions that we could get are a posterior shear, an anterior shear, a lateral shear, either direction, or a rotation, and I can actually show that here. A left rotation would be that the left side is more superficial, right side deep. A right rotation would be the right side superficial, left side is deep. Okay, so as we go down to assess, we slide down onto the coccyx, and we can feel if we bump into something that just feels like it's literally the entire thing is raised, that's the posterior shear. If it drops off like crazy, that could be an anterior shear. If one side is high, then we're looking at a rotation. And then if it feels like the entire thing is just shifted and doesn't want to spring back one direction or the other, we could call that a shear. Okay, so those are the joint dysfunctions. Now, the body dysfunctions are that we could either have a flexed coccyx or an extended coccyx, which I can't really show here, but it would relatively be lifted up. And then we could also have a side bend to the right or a side bend to the left, okay? And the way that we tell that is if we slide off and then it just like literally it just dips down and almost feels like it's at a 90-degree angle, I would consider that flexed. When you feel that though, if it's flexed, there would be ridges here that you kind of feel and then it dives down, versus an anterior shear is that this entire thing would just stair step down. It wouldn't be that it's this kind of flexed position. That's differentiating between those two. Extended is that we would be coming on here and then all of a sudden it'd feel like our fingers are kind of like going up towards the ceiling a little bit. That would be an extended coccyx. And then side bent, there's a bunch of other soft tissues in this area, so it actually doesn't feel like when you go to assess, there's not like 2 inches of motion here. There's actually like barely an ability to get your finger in that opening. So you would just check here how much space is there here versus how much space is there here. And then that can tell you if it's relatively side bent one side versus the other. Okay, so just overview, we have body dysfunctions, we have posterior shear, anterior shear, lateral shear, rotations, and then we have body dysfunctions, which is flexed, extended, or side bent. Okay, joint dysfunctions versus body dysfunctions. Those are all the possibilities of the coccyx.